I'm Amber Canto, Director of the Extension Institute for Health and Wellbeing, and I have the great privilege of moderating our discussion this evening. We know that when it comes to vaccines, and vaccines for COVID-19 in particular, that families may have questions, and our primary goal today is to address your questions. We are joined today by two speakers who will answer your questions about the COVID-19 vaccines. Dr. James Conway is a professor of pediatrics at the University of Wisconsin-Madison School of Medicine and Public Health, where he serves in a variety of leadership positions overseeing pediatric infectious disease and global health educational programs. He is a medical director for immunization programs at UW Health and serves on the Wisconsin Council on Immunization Practice. During the COVID-19 pandemic, he has served on the Wisconsin State Disaster Management Medical Advisory Committee and on the Emergency Operations Committees for UW-Madison and the UW system. He has also been a scientific advisor to healthcare and public health organizations regionally and internationally while working on an array of vaccine development projects. Dr. Jasmine Zapata is an award-winning author, public health strategist, and double board certified physician specializing in the fields of pediatrics and preventive medicine. She currently serves as the Chief Medical Officer and State Epidemiologist for Community Health within the Wisconsin Department of Health, where she provides expert guidance for a variety of public health promotion, planning, and policy efforts. She is also an assistant professor at the University School of Medicine and Public Health, where she practices clinically and is involved in a variety of scholarly activities aimed at increasing diversity in medicine and promoting health equity. She has many lived experiences that help her uniquely connect with the communities she serves, and is well known for her infectious energy, fierce advocacy, and heart for service. Her ultimate mission in life is to heal, uplift, and inspire. Please join me in welcoming our speakers. Dr. Conway and Dr. Zapata, thank you again for joining us today. We are very excited to have you. And to get us started, Dr. Zapata, can you give us a brief overview of what we know about COVID-19?
Yes, thank you so much for having us here today. This is such an important topic, and I'm so excited to talk about it. So, a broad overview of COVID-19, what we know is that COVID-19 is an infectious disease that is caused by a newly discovered coronavirus. The name of the newly discovered coronavirus is called SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. That's a big name, but let's focus on what it has been doing. This new COVID-19 virus can cause mild to moderate symptoms in most people. However, in some people, it can cause severe illness, hospitalization, and even death. The people that are highest risk for being severely ill from COVID-19 include older adults, but also include people with already existing underlying conditions such as cancer, diabetes, high blood pressure, or other chronic conditions. So we know that the best way right now to protect ourselves and our community from COVID-19 is getting vaccinated if you are eligible for that. Also continuing good hand washing for at least 30 seconds, not touching your face and limiting touching your face as much as possible. And then if you're not vaccinated, wearing a mask. And we talk about COVID-19 a lot, but let's talk a little bit about the numbers too, as far as a broad overview. As of this week, there have been about 600,000 Americans who have died from COVID-19, 600,000. That is the size of Milwaukee. I'm actually from Milwaukee, Wisconsin. That's the size of the population of Milwaukee, Wisconsin, and twice the size of the population of Madison, Wisconsin. That's where I'm living right now. And as it relates to children, about 21% of the new cases of COVID-19 occur in children. And most recently, some of the most recent numbers that came out have shown that we've had about 300 about 300 children in our nation have died from COVID-19. So even though it does impact certain groups of people even more, everyone is susceptible to this, and it is something that we must take serious precautions. Even though we're starting to have some hope and we're seeing the numbers go down, we have to stay vigilant and continue talking about this and talking about ways we can protect ourselves. Something else we know about COVID-19 is that we are now starting to see new variants. And what variants are is basically when you have a virus, over time, it mutates and it changes its makeup. And when it changes, in some cases, it can cause even more, it can spread even faster or cause more problems. So the best way to stop the variants from forming and spreading as well is to do all that we can to decrease the transmission of COVID-19. And again, that includes getting vaccinated, taking precautions, and being really careful and having conversations like this. So I'm going to stop there, but that's just a broad overview of what we know about COVID-19.
Thank you so much. You touched on some of those tools that we have to stop the spread of COVID-19, vaccines being the latest, one of the latest that we have available to us. And Dr. Conway, can you tell us a little bit about vaccines in general? How does a vaccine work to prevent illness?
Sure. So, I mean, vaccines are one of the most clever things that's ever been invented, if you want to really think about it, because essentially we're able to trick our immune systems into developing protection without actually having to go through the infection itself. And this was something brilliant that people discovered back in 1796, and we've had hundreds of years to refine this process. But when you get an infection, your immune system has to fight it off, and in the process of fighting it off, your immune system is pretty smart at figuring out what this thing is, and importantly, figuring out how can I protect myself from this happening in the future. And so we've figured out a way to basically bypass that part of it by essentially teaching the immune system, hey, here's a bad actor that you want to make sure that you are ready to deal with. And when it sees that particular thing, it's ready to go, fights it off before it makes you actually get severely ill. And so vaccines are really one of the most brilliant things we've ever done in science.
Thank you. And there are a few different vaccines that are available for COVID-19. Specifically, which of the vaccines are authorized for use in children?
So we have a number of vaccines that have come to the marketplace so far. Currently, there is only one that is available for younger individuals, 12 to 17 years, and that's a Pfizer vaccine that's based on an mRNA, which I think a lot of people are hearing about. And basically, the idea is using mRNA, the body then is taught to make its own stimulation for the immune system that then develop that long-term immunity. So we currently just have one vaccine, but very soon I expect that we will have a second one, since the other mRNA vaccine from Moderna has also submitted for approval for those younger individuals as well. So far, nothing for the kids less than 12. But we're hopeful that as science keeps marching along, that we will have those potentially in the fall.
And you noted that the mRNA vaccines are something we're starting to hear more and more about. This is not necessarily a new technology, but maybe you could tell us a little bit about how does the mRNA vaccine work?
Yeah, so this has been something that's been in the works for about 20 years. With the idea that the old model of vaccines was basically taking the actual infectious organism, growing it in the lab, and then figuring out a way to inactivate it and using that as the way to stimulate the immune system. And for many years, we've thought that there would be a better way of doing that in a more pure fashion by just delivering just certain pieces of the organism to be able to stimulate the immune system. And so these mRNA vaccines basically essentially provide a template for the immune system to make those pieces that then stimulate the immune system itself. So it's a much more simple way in many ways. And I think this is actually in many ways going to be the wave of the future for vaccines going forward, not just for diseases that we always have wanted vaccines for, but maybe even improving old vaccines and making them work better and making them work with less side effects.
One of the concerns that we often hear about with regards to the COVID-19 vaccines is safety. And Dr. Conway, could you tell us a little bit about how vaccine safety is monitored?
Sure. So with any vaccine, and this has been how we've developed vaccines for 50 years, you start with a very small group of people where you need to figure out what's the right dose of the vaccine. And so you're hearing about that currently being the testing that's happening in younger children, is figuring out what's the dose that we should give them. Then you move into a larger group of people where you really figure out how well does it work to make the immune response you want, and more importantly, making sure that it's safe in larger groups of people. The original studies for the 3 vaccines we have now from Pfizer, Moderna, and Janssen were done in 30, 40, 50,000 people before there was even a review of the information to decide that they could be approved. And I think the beauty of our system is that even once the vaccines are approved, that surveillance doesn't stop. And so there is ongoing constant surveillance so that we are able to then detect anything that's a rare or an unusual side effect. And so for people that have been sort of on the wait and see side of life, I think waiting and seeing is over. We've delivered over 300 million doses of vaccine have been given in the United States. 146 million people are fully vaccinated. We have now data on hundreds of millions of people to know what those side effects are and to know how safe these vaccines are. And there's been nothing of any substance that has come up that would make any of us change our minds about strongly recommending that everybody has the right and should have the opportunity to get these vaccines. And that's really, I think, one of the most important things to Dr. Zapata and I, is that everybody in our state and everybody in our country deserves to be protected against this disease, needs to be protected against this disease, and needs to have an equal opportunity to be protected against this terrible disease.
Thank you, Dr. Conway. And you mentioned, we know about side effects, and side effects are another common concern that we've heard from families with regards to the COVID-19 vaccine. Dr. Zapata, what are some of the common side effects that one might anticipate after having received the COVID-19 vaccine?
Yes, great question. And I experienced some side effects, so I can talk about them a little bit. But in general, the common side effects are having a fever, chills, tiredness, a headache, and pain at the injection site. However, they usually go away within a day or two. And that's literally what happened to me the day after I got my vaccine. I did feel tired. I had a headache. I just kind of felt under the weather. And then the very next day I woke up, it just kind of went away. I still had a little lasting pain at the injection site, but then after a few days that went away as well. After you get your vaccine, you wait in the clinic at least 15 minutes so that they can make sure there are no concerns, and then you're free to go on your way. And then most people experience those side effects that I mentioned.
You referenced them as normal. Should people be concerned if they have side effects from the vaccine?
Great question. If the pain and swelling or redness in the arm starts to get worse or expand over after that about 24-hour period, that's something where you should call your personal health care provider. If you start to experience any severe symptoms more than the ones that I mentioned, then that would be a reason to call your medical provider. And of course, if you're experiencing any medical emergency, to call 911. But when you experience those that I mentioned, headache, fever, tiredness, that's actually a good sign, because it's letting you know that your body's doing exactly what Dr. Conway mentioned, and it is preparing itself to be on alert if an invader comes in, which is the SARS-CoV-2. If COVID-19 virus comes into your body's going to know what to do. So when you do experience those side effects, it's actually a good thing to let you know that the vaccine is doing exactly what it was meant to do.
In the news recently, there have been more reports of inflammation of the heart following the mRNA vaccine. And one of our attendees had asked what do we know about this, and what concerns, if any, should we have with regards to COVID-19 vaccine? Either Dr. Conway or Zapata.
I'll let Dr. Conway start and then I'll follow up.
Perfect. So, we certainly are being very vigilant, paying close attention to any reports of any serious side effects. And I think people should be very reassured that our system is built so that every complaint, every report is taken very seriously. We sometimes, as an infectious disease specialist, joke that this is actually myocarditis season. And so that there's a certain group of viruses that circulate every year around this time of year. Some of them are respiratory viruses that are common cold type viruses called enteroviruses. Some are caused by mosquito bites. Lyme disease can cause myocarditis. And so this is the time of year where we see this. And so it was not unexpected that we always see a little bit of an increase in reports of myocarditis this time of year. But because some of the people that had myocarditis also had been vaccinated, the CDC and the FDA have been investigating very closely. And there does seem to be, at least at this point, a little bit of an increase in the number of people in a young age group having myocarditis that have been vaccinated than in the general population. There was a special meeting that was all day today, actually, that the ACIP held to review all this data. And the data I saw was that there's about 600 people that have had these reports. Remember, we're talking about over 300 million doses of the vaccine. About half of those, they were able to find some other reason for the myocarditis, but half of them, they think that there may have been some relationship with, as Dr. Zapata mentioned, you get vaccinated, it turns on your immune system to try to trick it. And so it does feel like you have sort of a mild flu. And so sometimes that inflammation can cause achiness in muscles and in joints. And it turns out that for a very, very small group of people, it also causes a little bit of inflammation in the heart muscle. But 85% of those people never even need to be in the hospital. Just some ibuprofen takes care of it, and they're back to normal within a few days. There are a small group of people, very, very small group of people, that they're following and watching a little bit more closely. So right now, it's still considered very safe and very reasonable for young adults and adolescents to be vaccinated. We certainly encourage people that have unusual or more severe side effects to make sure that people know about those so that they can be investigated. But right now, there's no sign that this is happening often enough that it needs to change how we are doing vaccines. The other side of the coin is that people need to recognize that people in the same age group who get COVID-19 infection, about 20% of them end up with myocarditis from the infection itself. And so when we're talking about balancing the risk from the infection itself versus the very, 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 that enough varies, very rare possibility that you may get myocarditis from the vaccine, I think I'm very comfortable, at least strongly recommending to my patients, families, friends, and neighbors that I still think the vaccine is far, far less risk than getting this terrible disease.
I agree.
Nothing more to go ahead. If you wanted to add anything more, please do.
What I would like to add is echoing what Dr. Conway mentioned about weighing the risks and the benefits and putting things in context. It's all about perspective. So when there are side effects, the very, very, I'll add a couple more very, very, very rare side effects. Guess who the news turns to? Guess who wants to do an interview with you? Those very, very, very rare cases of an adverse event. And that's what we see on our news feeds or when we open the news. So it gives the perception that it's happening a lot more. But what's not on the news is the millions of people who are getting the vaccine and have no heart issues or have no concerns. But that's not what makes the news. You're not going to go on the headlines and see, oh, 100,000 people today got the vaccine and nothing happened. They're not going to put that on the news. That's not what's going to be showing up on our feeds. So it's really important to actually know the information and know our numbers, as Dr. Conway mentioned. So that's all I'll have to add about that. It's really important to put it in perspective.
I just want to add, I think that is a really important point, that whether it's social media or mainstream media, there's a real focus on bad news. And I understand it's what makes people buy their newspapers and pay attention, but these vaccines are a miracle in so many ways. And the reason that we're all starting to be able to return to a life that resembles much more normal is basically based on these vaccines. That is what has allowed us to escape from being trapped at home for so many months for so many people, or for being frontline workers and being in a risky situation and having to worry every time you walk back into your house and expose your family to you. This is really what allows us to return to something normal. And as Dr. Zapata mentioned, we all have, especially if you get the 2-dose mRNA vaccines, the second dose, you certainly feel crummy for 24 or 48 hours. But I will still never forget that feeling of relief after having been on edge, and I did not realize how much stress I was carrying, always worrying about this virus and what it might do to my family. And all of a sudden, the sense of relief that I am now protected and that I can actually start to breathe normally. It was just the most amazing feeling. And I'm so happy so many people have experienced that same thing. And I still want more people to be able to feel that feeling. It is just so special and so important.
I can definitely relate to that feeling of relief. So I actually got COVID-19 right around Thanksgiving, like the end of November. I got COVID, my mom, my husband, and one of my 3 children. We all found out we had it within the same 2-day period. And thankfully, I didn't have to be hospitalized, but we were really sick. I had shortness of breath, headache, cough, runny nose, and I lost my sense of taste and smell. And if anybody knows me, they know that Dr. Zapata loves to eat. I love food. I love different types of food. And so when I could not taste or smell, that was horrible. I was like, oh no, this is worse than the breathing problems and the fatigue. And the symptoms lasted quite a while. I was out of work for about 3 weeks. And even when I came back, because I had been laying in bed for so long, I was deconditioned. So it really took a while to bounce back. And so when I think about my side effects from getting the shot, even though they lasted about a day or so, that was nothing compared to when I actually got COVID. And then I also think about my great aunt, who was in a nursing home in New York earlier in 2020, when the cases in New York were really spiking, and she passed away from COVID-19. And I had to attend her celebration of life over Zoom. And our family is extremely close. So that was just heartbreaking to have to go through that, and all of us couldn't be together. So when I think about how that impacted my family, and I think about the 600,000 Americans who did not recover and passed away, and I think about all the pain and anguish that caused families and the ripple effects, when you think about the side effects of the vaccine, it kind of, again, perspective, that's nothing compared to all the pain and suffering that some people are going through. So I can really relate to some of the points that Dr. Conway was making.
Thank you so
Oh,
much.
one more thing about the sigh of relief. I got 2 weeks ago, I got to see my great grandma, who is, no, it's not my, I'm sorry, it's late. I didn't mean, not my great grandma, my grandma. I got to see my grandma who lives out of state that I haven't seen in almost 2 years. And both of us were vaccinated and we finally got to see each other. And it was, again, a sigh of relief, the most amazing moment. She's actually 95. So not being able to see her this past year was very hard. And when I was able to hug her and talk with her and talk to some of my other family members I hadn't seen in a long time, it was such a sigh of relief.
Well, thank you both so much for that personal perspective. And Dr. Zapata, we are sorry to hear about your loss. And again, thank you for the honesty and sharing. Another common concern that we've heard, and one of our participants asked a question related to some of the long-term effects. Do we know anything, or what do we know about long-term effects of the COVID-19 vaccines?
Yeah, we know plenty. And I think one of the things people need to recognize is that we really did not change the process for testing or approving these vaccines. I think everybody should be aware that the old version of this taking 5 or 6 or 7 years was mostly bureaucratic review processes, but the science hasn't changed at all. When we talk about short-term side effects, those are side effects that happen in 1, 2, 3, 4 days after receiving the vaccine. Long-term side effects, there has never been a side effect that emerged anytime further out than 2 months after receiving a vaccine. So when we talk about long-term side effects, 2 months is plenty. We now have tens of thousands of people that were vaccinated over a year ago. Remember, these mRNA vaccines were ready to go by March, April of last year. At the same time we were all going into safer at home lockdown, vaccines were already ready to be tested. And we have now tens of thousands of people now that have been a year into their vaccines. The only thing that the long-term follow-up needs to determine is how long the immunity lasts and if and when we need booster vaccines. So the answer is we know plenty about long-term side effects, and there are none that we have detected that are anything more than what we figured out in those very first studies that started back last spring.
Thank you, Dr. Conway. And I think your answer just responded to this question, but I'm gonna say it out loud anyways, because it was something we received from participants. Dr. Zapata, do we know if the vaccines have an effect on fertility?
Great question. Currently, to date, there's no evidence that would suggest that they impact fertility in any way. So they're safe and effective even for those who are thinking about childbearing in the future.
Thank you. I'll maybe move us away from some of the concerns of effects and safety, and let's just talk about why vaccinate children. So we talked a little bit about this earlier, in that generally children have had less severe illness from COVID-19. Dr. Zapata, you gave us some perspective around some of the severe impacts for children. However, so the recommendation is pretty clearly still vaccinate children, and maybe just put a point on it. Tell us why.
I'll start and then I'll let Dr. Conway go. So I mentioned earlier that currently to date in the United States, we have had about 300 children die from COVID-19. And now some people might say, that's not a big number, but one child is too many. Going through my pediatrics training, and Dr. Conway has similar stories, I have seen children die in front of my eyes. I've had to talk with siblings whose brother or sister was getting ready to pass away. I've had to hear the cries of parents losing a child. My own brother passed away about 10 years ago, so it wasn't due to COVID. He passed away in his sleep suddenly when he was only 16 years old. And I went through the process of seeing my mom have to recover from that. So it doesn't matter how big the numbers are. When I hear that 300 children have died from COVID-19, again, one is too many. So it's extremely important to do everything that we can to protect everyone in our community. So that's number one. We want that number to zero. We don't want not one child to die from COVID-19 because they have their whole life to live. And the other reason is because we know that when we are vaccinated, we're protecting ourselves, but we're also protecting our community as well. So even if a child gets the COVID-19 virus, and they just have mild symptoms like sneezing or coughing, and then it goes away, the child is okay. Guess what? They can spread it to others in the community, and they might spread it to their grandma or someone else who might get that same virus, but become incredibly ill and die. So those are just two of the reasons we want every child to be protected, but also we know that they can spread it, and we want our whole community to be protected as well.
Yeah, as usual, I agree with Dr. Zapata and a couple of other really important things. I think people need to be aware that when we were in social distancing and trying to protect ourselves, we did a great job of protecting children and young adults. We unfortunately forced them to stay at home and spend school staring at a screen, which as pediatricians makes us crazy. But that was how strongly everyone felt that we needed to protect children because we didn't understand this virus. And I think what people need to understand is that when people say, well, children aren't affected by this and children don't commonly get ill with this, that was because we were doing a really, really good job as a society in protecting them. Now that children have started to return to more normal lives and normal schools, we see them actually starting to get infected, and we see them getting infected quite frequently. 22% of the population in the United States is under the age of 18, and 21% of the current infections are happening in kids under 18. And one of the things that's really scary as an infectious disease specialist, I watch this very closely, is that when teenagers get infected by this, and there's very clear data that has come out in the last few weeks, a third of them end up in an intensive care unit. So when adolescents are getting this infection, they're not getting a mild case of this. They're getting really sick. And a third of them that end up in the hospital end up in an intensive care unit. Most of them do survive, and it's sad when every one of them that passes away dies. But the ones that survive, it's a still very rough and rocky road. So I agree with Dr. Zapata 100%. Every kid deserves to be protected against this disease. If you ask them if they would want to get a sickness that would land them in a hospital, I know that the answer 100% would be no. And so we owe it to them to do the right thing and to protect them, because they do get really sick and they do spread it to other people. And the only way we're going to get out of this is protecting every member of our society and giving every member of our society an equal chance to be protected against this terrible disease. So we can't deprive the children and the adolescents the opportunity to be protected against this so that they can go back to living the normal lives that they deserve to be able to live.
Can I ask a follow-up question to you, Dr. Conway?
Of course.
Okay. I was reading some reports lately looking at that data about the percentage of mortality rates with COVID among adolescents 18 and younger were significantly higher in Black and Hispanic populations. Can you talk a little bit about that? And has that been what you've been seeing in the data as well?
It's been what we're seeing in the data, and more importantly, it's what we're seeing with our own two eyes with the children and adolescents that are being admitted to our hospital. Even with rates so very low in the community, there are still, unfortunately, children and adolescents being admitted, and they are BIPOC, they are children from communities of color primarily. And it's not clear what the reason is, and I think it's probably like everything in our lives, it's complicated. I think it's largely that they are more likely to be exposed and that they have family members and parents that are out working and earning money to keep their families healthy and fed. And they are in a lot of the spaces where there's a lot of exposure to large numbers of people. And so I think a lot of it is that there's just a lot more exposure. I think there's a lot that you know better than I about what the quality of the care is that they get and how they view the medical system. But it is clear to me that the communities of color are bearing the brunt of this. They have from the very beginning, and it is both heart-wrenching and unacceptable. And that those are the communities that are suffering so much. Those are the communities that deserve to be protected from this. And the only thing that I know to protect them is to get them vaccinated so that they are protected and can lead their lives normally.
Thank you. It's one thing to read the numbers, but then another thing to hear you say, I'm seeing it with my own eyes. So thank you for sharing that.
Every day. And I think people need to remember another thing about children and adolescents is that they get sort of the double whammy, as we call it, that they get COVID and they get a COVID infection. And fortunately, most of them get a mild disease. But that many of them, because they're such strong immune systems in response to this, they get this thing called MISC, this multi-system inflammatory syndrome, where their immune system fights off the infection, but then it keeps going and it doesn't turn off. And so many of the children and adolescents that get admitted to the hospital get admitted not because of their first COVID situation, but because their immune systems overreact to the virus and they get this other thing that also can be very, very serious. And so I think we're starting to realize that they really do sort of bear the brunt twice, that they get sick once, and then unfortunately a number of them get sick again. And sometimes that second go around is actually worse than the first.
For children who have had COVID, the recommendation to be vaccinated continues, and maybe tell us a little bit about the reasons why.
Yeah, because what we see is that, for most people that get a mild infection, unfortunately, they only get a mild immune response to the infection as well. And so one of the things we've realized is that those people, just because they had COVID, shouldn't be deprived of the opportunity to also be vaccinated and be fully protected against COVID. And so we do strongly recommend that even after people have had COVID, that they should still be given an opportunity and be vaccinated to be protected. Now they can wait, especially if you had a more severe version, we suggest they wait 90 days just so the side effects aren't too great. But I believe in my heart that everybody who had COVID deserves to be and should be protected by a vaccine.
We've talked quite a bit about some of the medical benefits of vaccination and sort of the physical health benefits. What other benefits come with being vaccinated? Dr. Zapata, do you want to take this one?
Yes, I can. So in addition to the physical benefits of protecting yourself, you're also protecting others and protecting your community, but also there are so many social and emotional benefits as well. We know that when you're vaccinated, it is able to help you get back to doing the things that you used to do before. Last night, I went to play pickup volleyball. I love volleyball. And that's something that I was able to get back to that I haven't been able to do for a while. Even being playing on a kickball team. We were in playoffs last night and it was so fun. Unfortunately, we lost. We didn't win the championship. So I'm still emotionally healing from that game last night. But being around my friends and family, having that social connection, it was something that because I was vaccinated, I was confident that I'm safe and protected and can get back to the things that I used to do. So that is the same, that same thing goes for children. I believe that what happened, me personally, I believe that all that happened last year is going to count as adverse childhood experience. For all the children who are living through this era, having to leave school abruptly, having the world shut down, being taken away abruptly from friends and teachers, and then just having to sit in the house for a whole year and watching on the news hundreds of people, thousands of people dying, I believe that has severely impacted children. So for them to get vaccinated and get to do more of the things that they used to do is going to have some very amazing benefits. We have already been seeing right here in Wisconsin, rates of depression, anxiety, and then even in some places, some areas, higher rates of suicide among our children, our adolescents and children. And I believe that is one of the negative side effects of all of this social isolation and everything that's been going on. So all that to say, in addition to physical benefits, getting the vaccine has a lot of social and emotional benefits, as well as we are able to let our children get back to doing the things that they used to do before.
And you can feel comfortable and safe not having to wear these darn things all the time. And I'll tell you that there is something wonderful about being able to see your friends and family and actually see the lower halves of their faces because everybody's vaccinated and you can feel comfortable being together. It is really important.
Yes, and what Dr. Conway said reminds me about the science of a smile. I'm going to be easy on everybody here. I'm not going to make you do it, but sometimes I do an exercise where I make everybody smile for 60 seconds. You just put the biggest smile on your face for 60 seconds. And what smiling does is it actually releases endorphins. It has an actual chemical reaction in your body. And endorphins relieve stress, make you feel good. And it also even helps relieve pain, produce happiness. There is power in a smile. Guess what? All these times where and smiles are infectious. So when you walk and you smile, most times people smile back. There's been some people who don't smile back at me, and I want to ask them, why did you smile back at me? But in general, when we smile, other people smile as well. What has been happening over the last year with all these masks? You can't see others smile. And I honestly, when I walk around, I just find myself, I'm not smiling at people as much because I'm like, they can't even see me smile under here. So even taking off the mask, like Dr. Conway said, and being able to just smile more, it's having real life biologic and chemical impacts on our bodies. But I'm going to stop there because I'm getting too excited. So I'm going to mute myself.
But I love it. I mean, it's just, I'm so happy to see your smile again after a year and a half of only seeing each other masked. But, you know, I think this is really important because then imagine our middle school and high school kids who have had to be distanced and masked. I want them to be back to normal school, extracurricular activities, sports and playing and running and hanging out in the hallways and being able to each other. And that's what vaccines and getting these rates down and keeping them down and being protected will allow, is that things can be that much more normal. And that's what I want for all of our adolescents and young adults, is that opportunity, but also the opportunity to know that they're also protecting their other loved ones that are around them so that they can be social, but don't have to worry every time they walk in the house about exposing grandma or exposing their aunt or exposing mom. These are all really important things. And our mental health is so important. And it's these little things that people don't even realize are gnawing away at them until you get the vaccine and suddenly feel that sense of safety and normalcy. It's this return of just feeling like yourself again. I've lived a long time. I don't remember ever really having felt something so special as what that felt like when I first got vaccinated.
Thank you both. Let's say folks are ready. They're ready to go get their COVID-19 vaccine. Where can we refer them? What information do they need to prepare for their vaccine appointment? Maybe Dr. Zapata.
Yes, there's so many places that you can go to get the vaccine. You can go to your local healthcare provider. You can go to DHS or local community-based sites. You can go to pharmacies. There are all types of places that you can go to get the vaccine. And one of the best places to look is going to vaccines.gov, and you can find the best place for you. So there are many places that you can go to get your vaccine. I recommend going to the place that you feel the most comfortable, a safe space, the place that you feel the most relaxed, whether it is going through your church, through a community center, to the local pharmacy, to the health department, to your personal doctor. There's so many options. Wherever you feel the most comfortable, you can get the vaccine. And how do you prepare for getting the vaccine? Some broad recommendations are, if a child below the age of 18 is going to get a vaccine, most places require that they go with their parents. So making sure a parent or guardian is there with them to authorize them getting the vaccine. Also, wearing a short sleeve shirt is a helpful tip. Because you're not vaccinated yet, making sure to wear a mask when you go and staying 6 feet distance away from others. Also, if you're going to get your second shot, if you're getting Pfizer or Moderna and you're going to get your second shot, make sure to bring your vaccine card with you so that they can check out that information. And those are just a few tips for when you are going to get the vaccine. And one I'm going to personally throw in, make sure you take your phone so you can take a selfie of yourself getting it. That's what I did. And then you can share it and remember this time in history. We're living in historic times. And one day you're going to have grandkids or great grandkids saying, did you live through the COVID-19 pandemic? And you're going to be able to show them your picture.
Well, thank you both so much for your time this evening. Your knowledge and expertise has been so incredibly useful. Any final thoughts or recommendations that you want to share with our participants today before we wrap up?
I guess I'll start. I'm going to give my friend here the big finish because she's the energy of our group, and I'm so happy about having her do all the things she does. I think the one thing I want to just make sure everybody is aware, and because we hear it so much, is that people need to understand that there were no corners cut in developing these vaccines, that everything was done exactly the way we usually do it. It was just done in a much more efficient way. And I honestly hope that this is a new normal, that when we develop important vaccines, why should it take years to get those to then be available? There's a new vaccine out that's just coming out now. It was approved 3 years ago, but no company will ever start manufacturing a vaccine until they get an approval. What this process did was basically make it worth the while to start manufacturing at the same time that the vaccine had been approved, so that these could be available as quickly as they are. We're living through a historic time, but we're living through a medical miracle as well, that we were able to figure out and streamline our system that had been a bureaucracy for many, many, many decades, to make things more efficient so that we could make these vaccines available, still balancing the important parts. Are they safe and do they work? And the answer is yes and yes. And everybody needs the opportunity, and everybody should take that opportunity to protect yourselves and your families. It'll allow us to be more normal, but to more importantly, stay more normal again. These variants that you're hearing about are real, and they are striking in areas where the vaccine rates are low. And so we are starting to see upticks in numbers of cases in those areas of the country where vaccine rates are lagging behind. We're doing a very good job here in Wisconsin. We are really one of the best states, but we still have lots of people who I understand have questions and want to have opportunities to get those questions answered. So talk to your medical providers, talk to your friends and family, because I know that there are many people that you know who have been vaccinated and will tell you why they did it. And then talk to your leaders in your communities, because they can help you understand why this is important for all of you. We all need to get back to normal, and we need to get back to normal together. And we can do it together, but it takes everybody to do it.
Yes, I would echo everything Dr. Conway is saying, and just in with reminding us all three of the vaccines are safe and effective in the best way to protect you and your community. The more people we can get vaccinated, the faster we can stop the spread of this horrible virus that's really personally impacting the lives of so many. If you have any questions, talk to someone that you trust or your personal doctor. And finally, even though this has been such a rough past year and a half, we're going to get through this together. So stay hopeful. Even after this conversation, I have a little bit more hope, and we're going to get through this together.
Once again, thank you both so much for your time this evening. Thank you to our attendees for showing up, for asking your questions. We hope this has been useful to you. I want to wish everyone a wonderful rest of the evening, and a quick cue to please fill out the evaluation survey. We value your feedback. It helps us improve our events and to improve our outreach. Thank you again so much. Have a great rest of the evening. Take care.
Bye-bye. Stay well.
Bye.
Bye.